The International Organization for Migration reports that 272 million people, 130 million of them are women, were living in a country not of their birth in 2019. Now, on this Women's Day, let's focus on the plight of women who migrate. Joining me now is head of the Refugee and Migrants Rights Program at Lawyers for Human Rights, Sharon Ekambaram. Thank you so much for joining us. A very good morning to you and a happy Women's Day. I suppose it's quite easy to forget and not pay attention to the mistreatment of migrant women when it comes to the focus and the conversation around women. You have written a really powerful article here highlighting the very many challenges that are around this conversation. Let's talk to some of them and you know, how they stand out as we discuss women and the role of women in societies.
Thank you, and happy Women's Day to you as well. Yes, I think I just want to start by putting it in context that Lily's Leaf and the National Institute for Humanities and Social Sciences is going to be launching a virtual exhibition this afternoon on women in struggle. And I think that it's important to locate the struggle that women have in migration. And the one point I want to just underscore as we start is that this is migration both internal within our country from other provinces predominantly coming to places like Gauteng, and then migration across borders, international migration, which is often because of reasons that are beyond the control of women and that they are forced to flee.
It's quite interesting that you speak about migration, which is internal, you know, moving from one province to the other. What are some of those big challenges that you've noted in that space?
Well, I think, you know, the article speaks to the experience of, in particular, women coming from our neighboring countries, trying to access healthcare in our country, and many of them wanting to give birth. And I think, you know, as I was thinking through this conversation with you, for many women living in places like Malawi and in other parts of the SADC countries, giving birth is like a death sentence. And so they come to South Africa so that they know they can have healthy babies born and that their lives are saved. And I think that this is, you know, what we are not seeing. Often ministers and politicians look at the health crisis, particularly in a province like Gauteng, and blame this on those foreign nationals, those women that come here, and if they don't give birth in our country, they would probably die. But what we're not looking at is the number of the migration internally with people coming from other provinces. We are not, there's no proper mechanism to document the movement of people, to provide disaggregated data, and particularly with internal movement. So if we don't know how many people are coming from the neighboring provinces, for example, then we can't budget accordingly for the number of people accessing healthcare in our public health systems. We wouldn't be able to ensure that the ratio of healthcare workers to patients is adequate to ensure a service that respects the dignity and the human rights of every person that is accessing healthcare in our province. So I think the internal migration is as important as understanding the plight of women who migrate internationally across borders.
It's important that you speak about the allocation of resources and a sufficient budgeting for that being something that should be highlighted and paid attention to by government officials. But another interesting aspect here, as we try and explore some of the reasons why women migrate, what stands out for me as you were talking about this is the abusive relationships and some of the reasons you are exploring as to why women migrate.
Yes, I mean, I think the one point that comes to mind before I speak about the abusive relationships is the fact that in many instances the movement particularly, well, actually both internal and across borders, is testimony of strength and agency that women apply in making this decision to move. And, sadly, on the African continent, we are seeing an increasing number of people that are fleeing because of persecution of their sexual orientation. And many people are coming to our country because of the equality clause in our constitution and the fact that we celebrate the equality clause in particular in relation to sexual orientation and the rights associated with that. But unfortunately, that experience in our country doesn't get treated in the way and ensuring the protection that people should get when they come to our country. I think then, as you point out, there's other violence in families, in homes. But I think that the majority of the reasons is that people are fleeing because of unlivable conditions, be that in a place like DRC, where rape is used as a weapon of war, and many women suffer shocking crimes because of the fact that they are women and come to our country. And then I think more generally, there's, we don't understand, and we haven't documented, we haven't allowed for, in terms of resources, the impact of the climate crisis. In many countries, specifically in sub-Saharan Africa, livelihoods are impossible because it's either too hot or too cold, or there's cyclones, or there's real adverse weather conditions that make it impossible to live off the land. And so people are fleeing, and these are climate refugees, and we are not taking this into account in our raising of resources and funds to ensure that people who are coming to save their lives are embraced and welcomed in our country, and that we're sharing in a way that can ensure that people at the end of the day live a life of dignity.
There's been a lot of focus. I suppose COVID-19 has brought a lot of focus on hospitals and access to hospitals and the number of resources that are available in hospitals. You speak about data not being recorded correctly and the repercussions of that. And what role do you believe that government can play when it comes to perhaps the narratives that scapegoating of migrant women plays in feeding messages to South Africans?
Look, I think that's a very, very important question. I think we're facing one of the most challenging, is probably too mild a word, the global pandemic of COVID. And what I think the criminalization of migration, the criminalization of the movement of people and women in this instance is further exacerbating the spread of a highly infectious disease. We need to regularize movement. We need to ensure that people have a means of moving so that they are not going to be scared of being arrested, of being detained, of being kept in conditions which are not conducive to controlling the further spread of COVID. And more than that, if you're scared of being arrested, you're not going to come forward and say, yes, I'd like to get a vaccine so that I can protect myself and can protect the community that I'm living in from further spreading COVID and getting people sick and going into hospital and dying. And so I think, we haven't woken up to the fact that this is a global pandemic. The virus does not respect borders. It does not stop at our gates because we've closed our borders. And the fact is that unless we can accept that movement is a part of humanity, human beings have moved since, the life began on Earth. And I think that we're failing in the way in which we are managing movement, particularly in South Africa, in further, making the lives of women who've suffered serious, hardship from where they're coming from to come into our country and get experiences of extreme xenophobia, as you know, and other experiences. And secondly, then we're not looking at this pandemic with a global perspective, with global lenses, so that we can bring it under control, so that we can save lives and we can reduce the number of people that are getting sick and having to stay in hospitals.
And what do you think the focus should be? I mean, as we reflect on Women's Day, and perhaps we'll be reflecting Women's Month, what should the focus be when it comes to government's role in ensuring that there is accurate data and that perhaps this doesn't then lead to xenophobic incidents where South Africans are complaining that hospitals are full because of people from other countries and South Africa not having the proper data to provide for all citizens when it comes to public hospitals?
I think, we need to be firstly embracing and embarking on a major national campaign of treatment literacy about vaccines, about what we need to do, about why, no one is safe until everyone is safe. And that doesn't respect citizenship, national boundaries, that we have to look at dealing with COVID as a global community. And whether you're rich or poor, you are exposed. But, the bottom line, I think, of what I was trying to do in this article is to demonstrate that it is the poorest that are disproportionately impacted by this COVID pandemic. And if we can't show empathy and deal with it, then none of us are safe because the virus is spreading precisely because of the deep inequalities in our society, and in particular, the impact that this is having on Black African women, not only in South Africa, but across the continent and in the southern hemisphere of the world.
Very well. Thank you so much. We're going to have to leave it there, although I do feel that this is a much more intricate conversation, and we've only just touched the surface when it comes to the many challenges and the solutions that can be at hand here. Sharon Ekambaram, head of the Refugee and Migrants Rights Program at Lawyers for Human Rights, speaking to us there as we commemorate Women's Month.